Now let's talk about something very important, which is a urogenital triangle. So urogenital triangle is going to compose the anterior half of the perineum. It has the following boundaries. So the boundaries are PII, which are anteriorly the pubic arch and laterally the ischial-pubic rami and the ischial tuberosities. And in the midline, there are urogenital openings in relation to the external genitalia. Urogenital triangle is divided into layers. First of all, we have the skin, then we have the superficial fascia of the perineum, and then the deep perineal fascia, and the fourth layer is the superficial perineal pouch, and the fifth layer is the deep perineal pouch. Superficial perineal pouch is present inferiorly, and deep perineal pouch or the superior perineal pouch. Now let's talk about the superficial fascia. So the superficial fascia is going to be divided into superficial fatty layer and deep membranous layer. These are the continuations of the superficial facial layers of the anterior abdominal wall. So the superficial fatty layer is also known as the Camper's fascia. It is going to be continuous with the fat of the ischioanal fossa and the superficial fascia of the thighs. So it is going to continue towards the thighs as well. And then in the scrotum, this fat is replaced by smooth muscle, which is the Dart's muscle, which contracts in response to cold and reduces the surface area of the scrotal skin. Now let's talk about the Colles fascia or the deep membranous layer. The deep membranous layer is going to posteriorly attach to the posterior border of the perineal membrane and the perineal body, and laterally it is going to attach to the margins of the pubic arch. Anteriorly, it is going to be continuous with the fascia scarpa or the membranous layer of the superficial fascia of the anterior abdominal wall. So PP, LP, and AS. PP is for the posterior boundaries for the perineal body, and then we have LP, which is lateral boundaries for the pubic arch, and then we have AS. So anteriorly we have the scarpa fascia. Now let's talk about the Colles fascia. So the Colles fascia is going to continue over the penis or the clitoris as a tubular sheath, which is continuous with the superficial fascia of the penis or clitoris. It also forms a distinct layer which is continuous with the superficial fascia of the scrotum or the labia majora. Now let's talk about the superficial perineal pouch. So the superficial perineal pouch is going to be present between S and PM. So S is for the superficial perineal fascia and PM is for the perineal membrane. Fascia and membrane. So it is closed behind by the fusion of the walls of the perineal membrane. So posteriorly by the perineal membrane and the perineal body. And laterally it is going to be closed by the C, which is the Colles fascia. So LC. Colles fascia is the membranous layer of the superficial fascia. And then we have laterally it is also going to be attached to the perineal membrane and then to the pubic arch. And what about anteriorly? Anteriorly they are going to be attached with a space. So anteriorly the superficial perineal pouch is going to be attached with a potential space which is present between the superficial fascia of the anterior abdominal wall and the anterior abdominal muscles. Now let's talk about the contents of the superficial perineal space. So there are two things which are going to be yellow, and then we have a C, which is for the crura of the penis or the clitoris, and then we have an S. S is for the STP muscles or the superficial transverse perineal muscles. So first of all, we have the bulb of the penis or vestibule along with the bulbospongiosus muscle. Close enough, right? So this was the first yellow thing. Bulb is yellow. And then we have nerves and vessels, which are perineal nerves and vessels. So why we have crura of the penis or clitoris and the ischiocavernosus muscle along with the retrovestibular glands, which are present only in females. Now let's talk about the deep perineal space and the urogenital diaphragm and their relation. So what comes to your mind when you think of the deep perineal pouch? You should think about all the things that we can see from the perineum, right? So first of all, you can see a distinct urogenital diaphragm which is deep to the superficial perineal space. Okay, so when we talk about the urogenital diaphragm, I want you to remember a triagonal structure. So it has 3 layers and it is flat and it is triangular. So it is flat, it is musculofacial, and it is in the anterior part of the perineum, FMA, and it has 3 layers, right? And it fills in the urogenital hiatus. What are the contents of the urogenital diaphragm? So we have 3 contents here. First of all, we are going to have the inferior fascia of the urogenital diaphragm, and we also have the superior fascia of the urogenital diaphragm. When we talk about the inferior fascia of the urogenital diaphragm, we are actually referring to the perineal membrane. And thirdly, what do we have? We have deep perineal pouch from the SD, from the sphincter urethri and the deep transverse perineal muscles. Traditionally, it is a 3D structure and it is not flat, okay? So deep perineal pouch is actually deep to the superficial perineal pouch. Perineal membrane is going to form the inferior boundary of the deep perineal pouch, and the superior boundary is going to be formed by the pelvic diaphragm. So perineal membrane, when we talk about the perineal membrane, which is what boundary? Which is the inferior boundary of the deep perineal pouch. So perineal membrane is a strong, thin, fibrous sheet that attaches along the ischopubic rami.